Hi, Dr. John Lipman again from the Atlanta Fibroid Center. I wanted to address a question that was raised during a recent virtual conference. Black Health Matters had a virtual conference on women's health, and there was a segment on uterine fibroids, which was very good. But they talked about uterine fibroid embolization, and the people that were giving the answers were not physicians, and they said that they weren't physicians. And so I wanted to clear up a couple of points about UFE that were made during this that were incorrect. The first is UFE patients can have children. They can be considered for fertility. In the conference, it was said that only myomectomy patients are offered fertility, but that was incorrect. If you are interested in fertility, you can have UFE. We've had numerous children born after the UFE procedure. I've had 4 sets of twins born after. The births are typically full term and vaginal, versus if you have a surgical myomectomy, they will not let you have a vaginal birth. You must have a C-section. And so UFE can be considered. It's something you want to talk about with an experienced interventional radiologist. It's not a simple yes or no. You have to know how many fibroids you have in the uterus, whether you've ever had previous surgery. Certainly, if someone has ever had a myomectomy before, there's no reason to get any more myomectomies. The reason that myomectomy fails people is that you can typically never get all the fibroids out surgically. And so invariably that means there are living fibroids left behind in the uterus when the woman wakes up from her myomectomy surgery. About 10 to 11% of patients will recur each year, so that by 5 years, over half the women have recurred with symptoms because the living fibroids left behind from the surgery grow and they develop symptoms again. Versus UFE, where after a UFE procedure, all of the fibroids should be completely dead, all of them. And so the chance of recurring is very unlikely. It does happen, but it's much less likely than myomectomy. And so these are important points to consider. How old is the woman? The older the woman is and the more fibroids she has, the more that UFE makes sense as a treatment option. The younger the woman is and the fewer the fibroid number, based on MRI, not ultrasound, because ultrasound dramatically underestimates the fibroid volume. So the fewer number by MRI and the younger the age, myomectomy makes more sense as the treatment option. So there are a number of variables, and it's really important to see an experienced interventional radiologist about knowing about all the options, being presented the surgical choices as well as UFE.